on the status of coronavirus in the country. On the day we announced to the country the confirmation of the first coronavirus case in Kenya, we implored the country to shift gears with regard to our lifestyles and behavior. At the risk of sounding like a broken record, we have repeated these measures every single day and asked you to embrace them for our collective good. These measures include regular and thorough washing of hands with soap and water and running water, or use of alcohol-based hand sanitizers, maintaining of social distance of at least 1 meter between each other, maintaining good respiratory hygiene by covering the mouth and nose when sneezing or coughing, staying at home whenever you feel unwell with symptoms like fever, cough, and difficulty in breathing, and utilizing our 719 call center number, masking oneself with appropriate masks whenever in public spaces, and correctly disposing the masks. Together with our constant messaging and regular briefings, we have rolled out a broad range of initiatives to stem the spread of the virus. The initiatives have been rolled out under the one government approach, including a cross-section of ministries, departments, and agencies. We have also worked with our development partners, county governments, private sector, and people who have extended their goodwill to prevent the further spread of this virus. Towards this end, we are working up to scale up the various interventions that we have. We are working to scale up availability of personal protective equipment to enhance our capacity to be able to combat this virus and to protect our health workers and medical staff. We continue to train the different cadres of personnel to be able to handle the various aspects in terms of dealing with this global pandemic. In collaboration with other government agencies, departments, and institutions, we have enhanced the country's capacity to mass produce hand sanitizers, and the distribution of the same is ongoing. We have also continued to issue various interventions, including the presidential directive on the countrywide curfew, cessation of mass gatherings, amongst others. And all these interventions, my fellow Kenyans, have grown a great mile in helping us fight against this virus. Our dedicated health workers and medical staff have been of tremendous help in the country's efforts to stem the spread of this virus. Together with measures taken so far to enhance their capacity and protect them, we are hiring 500 more doctors to help us combat this menace. In terms of our local supply, should we extend the current production capacity we have of our medical workers in the country, we shall go an extra mile to protect Kenyans by seeking collaboration also with our international partners to be able to have the right number of health personnel that we require. We do appreciate the risks placed to our health workers, and we have gone ahead to set up separate isolation and quarantine centers for our health workers and medical staff. I would like to thank Kenyans who have taken it in their stride to supplement the government's efforts. From the media, yourselves who are here today, who have continued to disseminate information to our people, to the various volunteers who have taken their time to sensitize the public on how to keep safe during this period, to our innovators and our entrepreneurs who are pulling all stops to design appropriate masks, to put in place hand-washing facilities, and to be able to use their various platforms in disseminating anti-coronavirus mitigation messages. We really do appreciate all of you, and we thank you. For our corporates, I'm pleased to announce today that Safaricom PLC has offered us the utilization of their more than 175,000 agents across the country to provide a logistic and distribution system for us. And as we continue, we shall appraise you of how that will work. I'm also pleased to announce that Kenya Prisons has agreed to engage and to help us in supplying and in making additional face masks. I would like to encourage institutions and corporations in Kenya to continue lending a helping hand as we fight this epic fight. In this same vein, I'd like to make a special plea for those who are in possession of oxygen cylinders that are not in use. kindly avail these cylinders to us. We do require these cylinders as they aid in boosting our capacity to be able to be serving our patients, and especially our critical care patients who may require oxygen supplementation. Ladies and gentlemen, this disease has shown itself to be blind to our creed, our status, our color, our age, and I dare say even our height. And it is for this reason we are calling for one-for-all approach as we try to protect ourselves and our country. More than ever before, we need to drop all our titles, our beliefs, our status, our age, and recognize that we need to fight this menace together. We do need to remember, fellow Kenyans, that this is a public health issue that we are dealing with. And therefore, in this regard, all private testing facilities, as a matter of law and invoking the Public Health Act, are required to share their results with the Ministry of Health for the purposes of monitoring this situation and ensuring that the proper notification is done in accordance with international health regulations. In addition to the previous measures that we've taken in place, we are adding on a new measure today. Starting today, all salon and barbershop operators must wear face masks while attending to their clients. Further to this, we shall be giving further instructions on how you restrict the number of clients you have in a salon to avoid the crowding in our salons and barbershops. We must also ensure that our salons and barbershops have hand sanitizers and their clients actually maintain social distancing and they practice basic hygiene in their operations. Fellow Kenyans, in the last 24 hours, we have tested a total of 305 samples, out of which 7 people have tested positive for the coronavirus disease. All the 7 are Kenyans. 4 of them have a travel history, 1 from Congo, 1 from the UK, and 2 from the USA. In terms of distribution per their counties, we have 5 of these cases having been tested in Nairobi, 1 in Mombasa, and 1 in Uasin Gishu. 2 of the cases emanated from our mandatory quarantine facilities, while 5 were picked up by our surveillance teams. This now brings the total number of those who have tested positive for the disease in the country to 179. In terms of age breakdown, of all our 179 cases, 3 of these cases are below 15 years of age. 49 of these cases are between 15 to 29 years of age. 114 of these cases are between 30 to 59 years, while those above 60 are 13. And fellow Kenyans, if you allow me to really emphasize on this, when we look at our age distribution, this coronavirus disease is actually affecting the more productive members of our society. You can see, like I've said, only 13 are above 60. And therefore, a large majority of the population falls below this, meaning we do need to take charge. We do need to observe the various interventions that we've put in place. The 7 people have already been moved to isolation in various health facilities, and contact tracing is ongoing. In terms of gender, 4 of the new cases are female, while 3 are male. With regard to contact tracing, a total of 2,004 persons have been monitored. Out of this, 1,426 have been discharged. 578 are currently on follow-up. To date, we've managed to test 5,278 samples from individuals. Now, in terms of severity, fellow Kenyans, when we break down our 179 cases, 1 of these cases is under critical care as we speak, and the rest, 178, have moderate to mild disease. However, we do have one piece of good news. One of the patients who was in critical care in one of the private facilities in the country has been discharged to the general ward today. This is a Kenyan who was in critical care, who was on ventilator support. He has now been taken off ventilator support and required to celebrate the various doctors who have been aiding in his recovery. 2 additional cases have been discharged in the last 24 hours. I want to wish all the affected Kenyans a quick recovery, and I thank you for your attention. We can have questions now.
We're only going to have 4 questions. So, don't give a lecture, please.